Life, in its essence, is a delicate balance. Our bodies are constantly regenerating, with old cells making way for new ones. This process is usually tightly regulated. However, sometimes this intricate balance goes awry. Cells begin to grow and divide uncontrollably. This uncontrolled growth is the hallmark of cancer. Cancer is not a single disease, but a group of over 100 different diseases. Each type is named for the part of the body where it originates. For example, cancer that begins in the lungs is called lung cancer. Understanding cancer means understanding how our cells work and how they can go wrong. Our journey into the world of cancer begins with this understanding. We will explore the science behind this disease and the incredible advancements being made in the fight against it. Our bodies have a remarkable defense system, the immune system. This system is made up of cells and organs that work together to protect us from harmful invaders like bacteria, viruses, and even our own cells that have become cancerous. The immune system can recognize these abnormal cells and destroy them before they can grow and cause harm. However, cancer cells are cunning adversaries. They can evade the immune system's detection, allowing them to grow and multiply unchecked. This complex interplay between cancer cells and the immune system is a key area of cancer research. Scientists are constantly working to understand how cancer cells evade the immune system and how we can boost our body's natural defenses to fight this disease. Understanding this delicate balance is crucial in our fight against cancer. Cancer is not a single entity. It is a diverse group of diseases, each with its own unique characteristics. There are many types of cancer, each named after the organ or cell type where it originates. Some common types of cancer include lung cancer, breast cancer, prostate cancer, and colorectal cancer. Each type of cancer has its own set of risk factors, symptoms, and treatment options. This diversity makes cancer a complex disease to understand and treat. However, by studying the specific characteristics of each type of cancer, researchers and clinicians can develop more targeted and effective therapies. Cancer cells behave differently from normal cells in several key ways. One of the hallmarks of cancer is uncontrolled growth. Cancer cells ignore the signals that tell normal cells when to stop dividing, leading to the formation of a mass of abnormal cells called a tumor. Another key feature of cancer cells is their ability to spread. Cancer cells can break away from the original tumor and travel through the bloodstream or lymphatic system to other parts of the body. This process, known as metastasis, is a major reason why cancer can be so difficult to treat. Understanding these fundamental characteristics of cancer cells is crucial for developing effective treatments. By targeting these specific properties, researchers aim to develop therapies that can stop cancer in its tracks. Section 5. The Immortal Cells, HeLa, a scientific breakthrough. In the annals of cancer research, one cell line stands out, HeLa. These cells, taken from Henrietta Lacks, a young African-American woman diagnosed with cervical cancer in 1951, have revolutionized our understanding of the disease. HeLa cells have a unique ability to survive and divide indefinitely in a laboratory setting. This property has made them an invaluable tool for scientists studying cancer and developing new treatments. However, the story of HeLa cells is also one of ethical complexities. Henrietta Lacks' cells were taken without her knowledge or consent, raising important questions about patient rights and the use of human tissues in research. Despite these controversies, the legacy of HeLa cells is undeniable. They have paved the way for countless scientific breakthroughs, bringing us closer to a future free from the shadow of cancer. Section 6. Fighting back surgery, a primary line of defense. Surgery is often the first line of defense against cancer. It involves removing the tumor surgically, preventing its further growth and spread. The success of surgery depends on the type and stage of cancer, its location, and the overall health of the patient. Surgical techniques have advanced significantly in recent years, with minimally invasive procedures becoming increasingly common. These procedures use smaller incisions, resulting in less pain, faster recovery times, and fewer complications. While surgery can be highly effective in removing localized tumors, it may not be suitable for all types of cancer. In cases where cancer has spread to other parts of the body, surgery alone may not be enough to eliminate the disease. Section 7. A targeted approach radiation therapy explained. Radiation therapy uses high-energy rays to destroy cancer cells. This treatment works by damaging the DNA of cancer cells, preventing them from growing and dividing. Radiation therapy can be delivered externally using a machine or internally by placing radioactive material directly into or near the tumor. Radiation therapy is often used in conjunction with surgery or chemotherapy to treat a wide range of cancers. It can be used to shrink tumors before surgery, destroy remaining cancer cells after surgery, or relieve symptoms in advanced cancer cases. While radiation therapy is a powerful tool in the fight against cancer, it can also have side effects. These side effects vary depending on the area being treated and the dose of radiation, but may include fatigue, skin irritation, and hair loss. Section 8. Chemical warfare, chemotherapy and its effects. Chemotherapy, often referred to as chemo, uses drugs to kill cancer cells. These drugs work by interfering with the ability of cancer cells to grow and divide. Chemotherapy can be administered intravenously, orally, or topically, depending on the type of cancer and the specific drug being used. Chemotherapy is a systemic treatment, meaning it can reach cancer cells throughout the body. This makes it an effective treatment option for cancers that have spread beyond the original tumor site. Chemotherapy is a powerful treatment, but it can also have significant side effects. These side effects can include nausea, vomiting, hair loss, fatigue, and an increased risk of infection. Section 9. Traditional treatments, effectiveness and limitations. Surgery, radiation therapy, and chemotherapy have long been the cornerstones of cancer treatment. These traditional treatments have proven effective in treating many types of cancer, improving survival rates, and enhancing the quality of life for countless individuals. However, these treatments are not without their limitations. They can have significant side effects, and some cancers may become resistant to these therapies over time. Moreover, traditional treatments often target rapidly dividing cells, which can harm healthy cells in the process. Recognizing these limitations, the focus of cancer research is shifting towards developing more targeted and less toxic therapies. These new approaches aim to kill cancer cells more selectively while sparing healthy tissues. Section 10. Shifting focus, prevention and early detection. While significant strides have been made in treating cancer, preventing the disease in the first place remains a top priority. Lifestyle choices play a crucial role in cancer prevention. Maintaining a healthy weight, engaging in regular physical activity, adopting a balanced diet rich in fruits and vegetables, and avoiding tobacco use can significantly reduce the risk of developing cancer. Early detection is equally crucial in the fight against cancer. Regular screenings and checkups can help detect cancer at its earliest stages when treatment is most effective. Section 11. The future of cancer treatment, gene therapy and immunotherapy. The future of cancer treatment lies in harnessing the power of our own bodies to fight the disease. Two promising areas of research are gene therapy and immunotherapy. Gene therapy involves altering the genes of cancer cells to make them more susceptible to treatment or to prevent them from growing and spreading. Immunotherapy, on the other hand, aims to boost the body's own immune system to recognize and destroy cancer cells more effectively. These groundbreaking approaches hold immense promise for developing more effective and less toxic cancer treatments in the future. Section 12. Conclusion. A journey towards a cure. Cancer, a formidable adversary, continues to challenge us. Yet our understanding of this complex disease has grown immensely. From the discovery of the double helix to the development of gene therapy and immunotherapy, we have made remarkable progress in the fight against cancer. The journey towards a cure is a marathon, not a sprint. It requires collaborative efforts from scientists, clinicians, patients, and advocates worldwide. With continued research, innovative treatments, and a steadfast commitment to prevention and early detection, we can strive to create a future where cancer is no longer a life-threatening disease.